What's the risk of coronavirus in the UK? Coronavirus symptoms and treatment. COVID-19 is a new sickness that can have an effect on your lungs and airways. It's induced by using a virus known as coronavirus. What's the hazard of coronavirus in the UK? The UK chief medical officers have raised the hazard to the public from low to moderate. Health gurus are working to contact everybody who has been in shut contact with humans who have coronavirus. What's the chance of coronavirus for travelers? There are some nations and areas the place there may be a greater danger of coming into contact with anybody with coronavirus. See our coronavirus recommendation for travelers. Symptoms of coronavirus. The signs of coronavirus are a cough, excessive temperature, shortness of breath, but these signs do not always suggest you have the illness. The signs and symptoms are comparable to different ailments that are a lot greater common, such as bloodless and flu. How coronavirus is spread. Because it is a new illness, we do no longer understand precisely how coronavirus spreads from individual to person. Similar viruses are unfold in cough droplets. It's very not likely it can be unfold via matters like applications or food. Do I want to keep away from public places? Most humans can proceed to go to work, faculty and different public places. You solely want to continue to be away from public locations, self-isolate, if suggested to by using the 111 online coronavirus provider or a scientific professional. How to keep away from catching or spreading coronavirus. Do wash your fingers with cleaning soap and water frequently, do this for at least 20 seconds. Always wash your palms when you get domestic or into work. Use hand sanitizer gel if cleaning soap and water are no longer available. Cover your mouth and nostril with a tissue or your sleeve, not your hands, when you cough or sneeze. Put used tissues in the bin straight away and wash your arms afterwards. Try to keep away from shut contact with humans who are unwell. Do no longer contact your eyes, nostril or mouth if your fingers are no longer clean. Check if you want clinical help. NHS 111 has an online coronavirus provider that can inform you if you want scientific assist and propose you what to do. Use this provider if you suppose you would possibly have coronavirus in the closing 14 days you've been to a United States or vicinity with an excessive threat of coronavirus. See our coronavirus recommendation for travelers. You've been in shut contact with anyone with coronavirus. Use the 111 coronavirus service information. Do not go to a GP, surgery, pharmacy or hospital. Call 111 if you want to communicate to someone. Getting assist in Scotland, Wales or Northern Ireland. Scotland, name your GP surgical operation or name 111 if your surgical treatment is now not open. Wales, name 111. Northern Ireland, name 111. How to self-isolate if you are requested to. If there is a risk you ought to have coronavirus, you can also be asked to continue to be away from different humans, self-isolate. This ability you should stay at home, not go to work, college or public places, not use public transport or taxis, ask friends, household participants or transport offerings to do errands for you. Try to keep away from traffic to your domestic. It is okay for friends, household or transport drivers to drop off food. You may also want to do this for up to 14 days to assist limit the viable unfold of infection. Read extra coronavirus self-isolation advice. Treatment for coronavirus. There is presently no precise therapy for coronavirus. Antibiotics do not help, as they do no longer work in opposition to viruses. Treatment targets to relieve the signs whilst your physique fights the illness. You'll want to continue to be in isolation away from different humans till you have recovered.